If you think fungus is the cause of what ails mankind, you are watching the right show today. We're going to open up with a story about an asthma drug. I think most asthma is due to indoor mold, right? An asthma drug that's also helping with skin problems. The asthma drug has antifungal properties. So what do you think causes skin problems if the asthma drug is helping? Fungus, right? Dr. Mukesh Saraya is an amazing man. I've known him a little over a year. He's looking into people's lungs with bronchoscopy, and guess what he's finding in there? I'll let you hold that thought for a few seconds. Jenny Herbachik is going to be here today talking about yeast and fungus, and then Dr. Ann-Louise Gittleman, all that and more on today's Know the Cause. My name is Doug Kaufman. For the past 40 years, I've dedicated my life and even my career to finding the root cause of disease. Join me in a team of physicians, pharmacists, and scientists, and soon you too will know the cause. So I had this wonderful girlfriend many, many years ago, and she had a condition called dermatographism. It was why I was interested in dermatology. But she used to write messages, "Still going to the movies tonight?" on her arm. And 3 or 4 minutes later, it'd be gone. But it'd swell, there's the message, and then it was gone. Dermatographism is often associated with another skin condition called urticaria. You and I call it hives. Doctors call it urticaria, okay? So I read a report recently. Well, I'll share it with you. Let's go down that road together because this is fascinating. Asthma drug helps skin disorder. Okay, sidebar. Doug Kaufman has published that he feels asthma is intimately linked with mold, mildew, and fungus. By the way, I worked in dermatology for many, many years, so I know skin conditions like psoriasis very often are intimately involved with fungus. Doctors don't, dermatologists don't. But I do. I had a couple of dermatologists who allowed me to use antifungal drugs, and some of their conditions cleared up. So I think asthma and I think skin disorders mostly have a fungal etiology, right? Always check with your doctor. I'm not a doctor, but I do play one on TV. Asthma has long been scientifically linked to mold and fungus. There's plenty of reports. Reporting in a medical journal, doctors now have found that the asthma drug Xolair can also successfully treat cold urticaria or hives. How does it work for urticaria? Do you love the name of drugs? Xolair is also called omalizumab. Who sits in a room and says, I got an idea. This drug works for urticaria. Let's call it omalizumab. Well, that's a great idea. Here's a $10,000 bonus, omalizumab. Okay, it's called Xolair, okay? Wow, what are the brains that come up with this? This I kind of liked. Steroid-sparing effect of this drug Xolair for allergic bronchopulmonary aspergillosis and cystic fibrosis. Steroid-sparing effect of this drug for fungus. Allergic bronchopulmonary aspergillosis is a fungus. Aspergillosis is an infection caused by the fungus Aspergillus. So you see, this helps people with fungus. You see where I'm going? Do you see where I'm going? Many studies have proven that Xolair helps treat fungal problems because it is an anti-IgE monoclonal antibody. Technical stuff. Bottom line, I think Xolair works because it kills fungus. Works for asthma patients. What causes asthma? Any of you have fungal-induced asthma? Man, you go in that old building, you go in your neighbor's house, as clean and spick and span as that house is, you sit down in their chair and 10 minutes later, I'm sorry, I have to leave. Oh, we have a cat, it must be the cat. It's the 80-year-old house. One time the bathtub leaked, one time the roof leaked. You don't just clean the water up and go about. Fungus loves it when your house leaks because it gets to go from outside to inside your home. And you keep that home 70 degrees, and it's hot out there. It's 105 degrees in Texas in the summer. It wants to come indoors. But what does it eat, Doug, once it gets indoors? You don't let it in your refrigerator. It eats wood. Wood has a sugar called cellulose. It loves your floors. It loves the wall panels. It loves what's behind the wallboard, those 2x4s that built your home. And when you stop to think about it, folks, was your home built when it was raining? Did they put up the whole 2x4 frame and it started raining? We don't know. But for many people who have health problems, breathing problems, or skin problems indoors, mold is the problem. Many studies have proven that that asthma drug works because it's an IgE, which is an allergy protein, monoclonal antibody. Really? If you put it on a plate, would it kill fungus? Take-home message, if you suffer from asthma, cystic fibrosis, or isn't that fascinating? They're now linking, fungus with cystic fibrosis, thank God. Or bronchopulmonary aspergillosis, have you associated your problems with mold? Guys, we have to, I've done this on this show before, kids, we're kind of on our own. There isn't an aspergillosis specialist who will come to your house. There are some very good mold companies that know this stuff, and I'm big on mold companies. Sometimes these 30, 40-year-old guys know far more than infectious disease people. See if aspergillus is growing in your house, leading to a condition called aspergillosis. If so, you may well benefit from talking to your doctor about the Kaufman diet, good luck on that, and long-term natural anti-germ plant-based supplements and beta-glucans. After all, when fungus is around, don't you just want to jumpstart, bump up, modulate your immune system? Hope that helps you. Friends, joining me right now is a buddy of mine the past year. We're on the phone. It seems like a lot. Our wives are upset about this. Dr. Mukesh Saraya is board certified in internal medicine, pulmonology. He is in Denton, Texas, not far from us here. His world changed when he attended a conference on mycotoxicology, the ability of fungi to off-gas and those gases to make us deathly sick. Here's a guy who would lay a patient on a table. He's a different kind of pulmonologist in that he wants to do bronchoscopies. He wants to see. More importantly, he wants to know the cause. Dr. Saraya, thank you for coming in. Really appreciate your time. So I scrubbed in the Navy, 1,000 years ago for some of these cases with pulmonologists, and the patient's head would go back and in would go this tube. And that was before TV sets. The doctor had a little thing, he'd look down, whoa, 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 it's all white or it's all mucusy. And he'd have a little, and he'd suck some of that mucus out. It was never tested. Back then, it would take weeks, for a fungal culture to come back. And what would happen is we just randomly write a prescription for an antibiotic for that patient, assuming that infection was bacterial. You changed your way of thinking here a year ago or so. Tell folks about that.
Well, Doug, that was one of the best conferences I attended. And to be honest, I was quite ignorant of the fact that what I was looking at was actually a pathogen. So, again, getting back to knowing the cause, about what was going on. So, as a pulmonologist, by the time patients come to see me, they've already been on various antibiotics. Levaquin, Ceftin, Omnicept, things like that.
Do they see you because they can't breathe or because they're coughing or?
They're coming in miserable. A lot of them, they have normal-looking X-rays. They can come in, and I'm also seeing a lot of patients that are now undergoing the fast CT scans, like the calcium scores that they do for the heart, and incidentally, they would notice some nodules here or there. Some mosaic pattern. A lot of them have been coughing for a long time, and are not really getting the answers. They're being treated for allergies. They're being treated with antibiotics. And by the time they've come to see me, they've already been on various different antibiotics, which kill the bacteria. And there's nothing else left for me to do besides actually getting to the root of the problem, which is through a bronchoscope. And what you just described, the procedures improved tremendously from the time you were, as you can imagine. Yeah. So, what you're describing there was a rigid bronchoscopy, where you had a steel tube. Now we have fiber optics. Most people have undergone upper endoscopies, like EGDs, colonoscopies. It's very similar to that. The instrument is much thinner, to be able to go through the airways. So basically, they're sedated, they're numb, they're sedated. It literally takes me no more than 5 to 7 minutes to do what I do.
Okay.
Because
does that little device go into the bronchial tree, and is that where mucus ends up?
Absolutely.
Do you take some of this mucus and test it?
Absolutely. So basically, typically we go through the nose. If the nasal passage are blocked, we go through the mouth, look at the vocal cords. Go inside, and basically travel down the bronchial tree. And as we do that, I encounter mucus, and that's sucked out. That's sucked out. Put in a mucus trap. Oftentimes,
This is a suction device, right? This
Yes.
on the left. Okay. And what is that? The bronchial?
so this here is kind of looking down the right bronchial airway. So this is very, very inflamed. This redness, it should be pale like this. All this
Okay.
redness is inflammation. This is an airway that you're looking down, through that. That's a plug of mucus that was just sitting there, just literally blocking about half the airway. So when it's sucked out, basically what you're looking at, these are plugs of mucus, and you can see how it's branching out.
Yep.
So basically, the mucus is so thick and tenacious that it actually takes the shape of the bronchial tree, through which you have to breathe through. So when you are blocking off an air passage that is, like proximal, like in the right middle, bronchus intermedius, you're blocking off thousands of alveoli, or the air sacs, through which the air has to be absorbed into the body.
So now the patient wakes up. Can they breathe much better?
They are like different people by the time they leave the hospital.
And so here's my problem. 3 days later, a week later, they're blocked up because they have no idea that their food is feeding the yeast.
Absolutely.
That is growing in there. Can you empirically, before you get the test back, put a patient on an antifungal? You're finding how many patients out of 100 would this be fungus?
I would say 80%, 80 to 90% easy.
And other pulmonologists have no idea.
Well, typically, conventional wisdom has it. Even current teaching right now is that if you find mold, so I practice out of 2 hospitals. So one of them would not identify the yeast, beyond telling us that it's yeast and not Cryptococcus, and you don't need to worry about this. And then we have another hospital where I kind of insisted that we need to go further. It costs money to, to get to this point. So when I started kind of comparing my results between the 2 hospitals, the hospital that I'm currently practicing out of will actually tell me what the mold is, what the fungus is.
Good.
So we're looking at Penicillium, Aspergillus, Bipolaris, Fusarium. And when you look at this, you cannot ignore it. Once you've looked at it, you know what you're identifying. The treatment there, would be antifungals. Now, I used to stop short of that until I attended the mycotoxin, meeting where I started realizing that it's not just, what's in your lungs, it's what's in your environment, it's what's in your food. And I can tell you, Doug, when I first listened to your phase 1 diet, I'm a vegetarian. My diet is wheat-based, rice-based. If I had to follow that, I think I would have the hardest time.
It's difficult, isn't it?
It is a difficult diet. But of late, and I think this is very, very important, we have started recommending the diet to the patients that are desperate. In fact, I'll give you a case history here. 81-year-old retired rheumatologist. He comes to me after 7 weeks of being in and out of the hospitals and being on antibiotics. So I've actually given up hospital practice. I just do outpatient procedures. I do office practice. And I don't miss the hospital at all because I think there's a lot going on there that I don't like. So basically the guy comes in, the doctor comes in, extremely congested, looked pale. In fact, he resembles my dad so much that I really, my heart just went out to him. So I see him on a Tuesday. I'm talking about maybe 2 weeks ago. See him on a Tuesday. My procedure day is Wednesday. I put him on the schedule that day. And the amount of mucus plugs that we got out of that was absolutely horrendous. Now, this gentleman, his chest X-ray didn't show anything. There was no infiltrates. Yeah.
What about his blood work?
The blood work was just fine. So somebody that is not really listening to that person, that's not really listening to the story, not listening to the lungs the way it should be listened to, is totally, and it was missed for 7 weeks by numerous doctors. And so when I discovered that, it grew out penicillium. It took 2 weeks to culture, but we got that out. I had him on antifungal. Then I listened to him a week later. So he started filling back up again. And this is when, he had come in with his wife, fortunately, and we went over the diet with him. So when I listened to him the second time, I said, I'm probably going to have to go clean you out again because I already knew that he was how difficult it would be for him to breathe through all those mucus plugs. Put him on he was reluctant to go through a second procedure. He said, I can't keep on doing this, and I agreed with him. So I saw him on a Friday. I said, get on this diet. If you're not well by Tuesday, we'll go scope you. And he was ready for that. I even had him on schedule for that. He calls me on Monday, and in fact comes in to actually see Bennett to pick up some supplements, the antimycotoxin supplements. And he said, and I listened to him, this was clearer than I'd ever believed that he could be.
The diet.
The diet, yes.
Yeah, I mean.
So that changed it completely for him. He lost, in 1 week, he lost about 3 or 4 inches around his waist.
Yeah.
And
we saw this. This was frustrating for me, guys. Here we have a real physician who's telling you I may have been doing it wrong, but my peers are still doing it wrong. You don't see a lung patient, hand them an antibiotic. Oh, you do by the book. You don't by the patient. You need to know the cause of what is blocking him up. The diet starves fungi. The doctor is now doing well. I really appreciate you being here and educating us. You're seeing this more and more.
Absolutely. It's just unbelievable.
Yeah.
Day after day after day, in the last 2 weeks,
yeah,
we've had patients, and it's amazing how typical the story is. It's mind-boggling. It's like they're talking to each other, but they'll come in, they'll hold their pens out and say, 3 inches.
Yeah.
3 inches, 20 pounds.
He's doing what he wanted to become a doctor for. He is knowing the cause and helping the patient get better. I appreciate your time today.
Thank you so
very
much for
Dr.
the knowledge
Soraya.
you're imparting.
You bet, you bet. I know we went a little long with Dr. Soraya, but when you're getting information like that we all need, well, thank you, Dr. Soraya. Now, Nurse Jenny talks about a cause of cancer many of you don't know, but I do. Then we go to Dr. Ann Louise Gittleman, New York Times bestseller, then to pharmacist Susie Cohen. What a lineup.
Hi, I'm Jenny Herbacek with the Cancer Connection. If you've been watching Know the Cause for any length of time, you should have a pretty good understanding of the connection between fungus or yeast and diseases such as cancer. Did you know that you can have an overgrowth of candida without any outward symptoms such as nail fungus? You might consider asking your doctor to order a serum Candida albicans antibody test. It's a simple blood test and it can reveal an unknown fungus issue. Then stay tuned to Know the Cause for simple strategies that can be implemented for an antifungal, anti-yeast lifestyle. For Know the Cause, I'm Jenny Herbacek.
Oh, Dr. Ann Louise Gittleman joins me right now. A little bit jealous I am. So every year or every other year, I go to California and speak at the Cancer Control Society. Went a couple of years, or last year I went. And they're on the first row, not me, I'm on the 12th row. On the first row is Dr. Ann Louise Gittleman sitting there. We went up and hugged each other and said, hey, how you doing? Great to see you in California. She's getting an award. The first lady of nutrition is sitting with us today. Many years ago, decades ago, I remember reading magazine articles of what she was doing, and much of what you see today, understanding the etiology or knowing the cause, stems from things I learned from mentors. And Dr. Ann Louise Gittleman was writing 30 years ago that, gosh, fat isn't bad. Fat flush plan. We're going to talk about this in a minute. And grains, guys, you got to be careful of grains. And I'm going, holy cow, she knows exactly what I knew so many years ago. Thank you for coming in today and meeting with us. So did you speak at the Cancer Control Society?
I did. I talked about parasites, which is an underlying hidden weight gain factor in my new book, but is also a root cause of disease. And I used to think, Doug, that parasites were one of the root causes of cancer. I've now come to realize that it is a cause, perhaps, of certain degenerative diseases, but I truly am now believing the way you do that fungus and yeast has a much more deleterious role in setting the internal environment so that people come down with degenerative illness.
And remember, fungi do parasitize man, and so
There's
it
a
works.
connect.
So maybe I can be on the first row. Are you listening, Lorraine? Maybe I can be on the first row next year. But I'm so proud of you because I see all these awards that you have won, and I see you on, ABC News, and I see you on New Woman's Magazine that you have a huge article in. I mean, you've really given the public fuel. We decide, folks, if we're going to go to a doctor. I decided 40 years ago not to. I worked in hospitals and clinics, and I saw hyperdiagnoses existing. One of which is your gallbladder is shot, your liver is shot. We're going to have to take that liver out and give you a new one, and we can do a cholecystectomy and pull the gallbladder. And by the way, doctor, will it affect my coldness or my thyroid? Nah, not at all. Folks, I got to tell you, and you know this, trust is my major issue. Then I sit down and I look at the Fat Flush and now the new Fat Flush book. And the information in this on my internal organs, they're not inconsequential. When you pull them out, it's not inconsequential. And I learned that the gallbladder affects this.
Interesting.
And how many of us have thyroid problems?
I mean, it's very interesting. So what they're finding, some of the researchers at Harvard as well as in Finland,
Yeah.
that when people get their gallbladder removed, they come down with a sluggish metabolism, so it affects the thyroid and they develop hypothyroidism. I mean, who would have thought that? And that's an epidemic. I mean, everybody we know has a sluggish thyroid.
And everybody's had their gallbladder out.
So there you go. So there's a connection. So apparently there's something about the release of bile, the timed release of bile, which is what your gallbladder is in charge of, that impacts the conversion of T4 to T3 in the thyroid. So that is like major. So that's part of our program, and we give you the way in which you can assure that your bile is free-flowing, it's high quality, and it does not get clogged or congested. That's a no-no.
Can they know really in 3 days? Can you sample, like what you're talking about here? In 3 days, can someone who's had a cholecystectomy, the gallbladder's gone, they're hot when it's cold, they're cold when it's hot, they're miserable. In 3 days, following your rules here, which aren't, overly
Stringent.
difficult, can they really feel a difference in 3 or 4 days?
Well, I have a 3-day tune-up that we test drove with many of my clients, and people lose 17 pounds sometimes in 3 days. Not everybody, but many.
Yep.
People lose inches, that I can promise. Yep. Feel better, and they start to cleanse. So it's a detox to kind of prime your system for phase 1, 2, and 3, and then once they see such great results, it motivates them to continue. We also have a very active Facebook page, which is the Fat Flush Nation. There we go, Fat Flush Nation on Facebook, that people join. I'm there kind of giving them tips and guidance and hints and giving them as much inspiration as I can. And we see that there's strength in numbers. I mean, many women that are perimenopausal and menopausal cannot lose weight because of a sluggish thyroid and a sluggish gallbladder.
You really need to read the book. And by the way, we did a couple of podcasts when she was here. And so go to our podcast on knowthecause.com. The new book is called The New Fat Flush Plan, inexpensive on Amazon.com. You are wonderful. Thank you.
Thank you.
You bet.
I just love cooking with coconut oil. It contains lauric acid, which kills pathogens like fungus. We hate fungus around here. It offers another compound called monolaurin, which kills harmful germs in Staph aureus and Candida albicans. So make sure to put a little coconut oil in your recipes. It'll help you stay fungus-free.
Hey, thank you so much, Dr. Ann Louise Gittleman. Great information. And Susie, dead on with the coconut oil. Thank you, Dr. Soraya, for lending your intelligence. I mean, when we're seeing 90% of lung problems linked with mold, we got a problem. Thank you also, Nurse Jenny Herbacek, for realizing yeast, mold, and mildew does induce cancer. And then finally, folks, I don't recommend you take this drug, Zolair. If your doctor recommends, definitely you want to take it. I'm not saying take Zolair if you have a skin condition or asthma. I'm saying you have now honed in on the cause. So do you think you need to keep taking a lot of drugs, or do you need to look at an antifungal lifestyle, okay? God bless you, folks. We'll see you next time. Bye-bye.